Hello, everyone. Welcome to another episode of the Black Beauty Activist Podcast, where we discuss critical conversations to enhance the cultural consciousness and raise awareness for Black beauty confidence. I am your host, Dr. Tameka Ellington. And for those that don't know me, I'm a scholar, empowerment speaker, author, and a lover of all things Black culture. And so I'm excited to get back on with the Black Beauty Activist Podcast. This has been a very busy month for me. Usually February and March are my two busiest months out of the year. I've been doing lots of different speaking engagements about Black beauty. I was just at the Cleveland Public Library. They had an event, Natural Hair Summit, and I was their keynote as well as a panel moderator, and we had an incredible conversation over there. So I haven't been able to get on the podcast as often as I usually am, and so I apologize for that, but I'm glad that you all have come back, that you all are interested in these conversations so that we can be able to move Black culture forward. In today's episode, we will be discussing the disparities that Black patients face in medical treatment and diagnosis. And so my next guest is an advocate and activist in her own right. She is working to level the playing field for Black people in healthcare. And so Black beauty activists, it is my pleasure to introduce you to Angela Udongwo. And that's, I hope I pronounced your name correctly, Udongwo, right?
It's Udongwo.
Udongwo. You know what? Let me just say
Udongwo.
this. Please, I'm going to ask for forgiveness already. I am terrible at pronouncing names. I'm terrible.
Me too.
Please.
Oh, me too. And I literally, I try so hard. Sometimes I get so nervous and I just like whisper names because I don't want to mispronounce it. But like, yeah, that's something I apologize all the time for. So
yeah,
I do all the good for that.
Yeah. But okay, say it one more time for me.
Udongwo, like ooh. So they use like a ooh.
Ooh.
And then Dongwo.
Udongwo. Isn't that Nigerian?
Yes.
Is it a Nigerian name? Okay. Yeah. Okay. So welcome to the Black Beauty Activist Podcast. It is a pleasure to have you. We've been kind of going back and forth with the schedules, and so I'm so happy that we are able to have this conversation today. For those of you that are interested to find out how I got connected with this amazing woman, I think I was on Instagram or I was on someplace, but I'm always always catching up on things that are in relationship to Black beauty and culture, Black hair in particular. And Angela's doing some amazing work at her university. And so I'll read her bio so that you all can become familiar with all the beautiful work that she's doing. And so Angela is a passionate, driven leader who aims to advance healthcare, innovation, and impact both local and globally. She is currently pursuing her medical degree at Temple University while serving as the president of Aspiring Physician Executives, a network of medical students and professionals who aspire to diversify physician leaders at health sector intersections. With a background in global health business, Angela has extensive experience in developing and implementing digital strategies, partnerships, and solutions for various healthcare challenges. She is the co-founder and former CEO of InnoHealth Diagnostics, a startup that created a microchip diagnostic device for, you're going to have to help me with this one now, honey. What's this?
Schistosomiasis.
Okay, wait, say it one more time.
A neglected tropical disease is schistosomiasis.
Oh my gosh. And so this was a disease that—
Such a great word.
Okay, this was a disease that plagued many people in Africa, right? What part of Africa in particular?
West Africa in particular, but also parts of East Africa like Egypt, and then also a lot of parts in South America like Brazil and some other places.
Okay. And so your company came up with a medical device to help with the effects of this particular disease, right? So under her leadership, InnoHealth won multiple innovation awards, secured funding and partnerships, and conducted field research in Nigeria. And so Angela also worked as a global health consultant for Emory, advancing healthcare innovations in Africa, where she oversaw digital programming and collaboration with universities and organizations across the continent. Angela's core competencies include qualitative research. I'm a qualitative researcher myself. I love qualitative research.
Okay, hey.
Yes, yes, yes. And you don't find that very often in the medical field, people doing qualitative research. So I'm proud of you, young lady. Proud of you. Yeah.
Thank you.
Relationships and sales enablement. So she is skilled in identifying, addressing, and solving problems using patient user-centered approach and working in multidisciplinary teams. She is motivated by her vision of empowering communities that have their health needs blocked by structural barriers, and by her curiosity and creativity in finding new ways to improve health outcomes and access. I love that. That is so beautiful.
Oh. Wow. Thank you for the bio, for reading that bio.
I mean, it's beautiful. You're doing some wonderful work for our people, for sure. We definitely need you, for sure. And so it is a pleasure, yes, to have you with us. So thank you again so much for taking some time out to come and to talk to me about the work that you've been doing, the research that you've been doing. And I'm excited for everybody to hear about it, because I believe that once you all get this all together, it's going to change a lot of things in the field of radiology. And so please tell the audience a little bit about you, how you grew up, and what got you interested in becoming a doctor. Uh-oh, I think there's a little bit of a delay. Angela, can you hear me, honey? Can you hear me? I can't hear you. We were just good. What happened, I wonder? Okay. Maybe she had a bad connection. So we're going to see if we can get her to come back in. So I'll take her out and maybe we can bring her back in. So hopefully, okay. Let me see. Angela?
Hey.
Okay. All right. Awesome. So please.
Can you hear me? I can hear you.
Yes, I can. I can hear you. It's a little bit delayed though, for some reason.
Perfect.
Just so you know. So if I ask a question, it might be a little bit delayed. Okay, so tell us a little bit about yourself. Okay. So how you grew up, where you grew up, and what got you interested in wanting to become a doctor.
Yes. So I grew up in Atlanta, Georgia, and Jacksonville, Florida. I grew up in a household with parents that had just immigrated from Nigeria. So what that means is there was no conflict that their kids were facing that they didn't face in Nigeria. Or no conflict that outdid that. So in our household, education was really emphasized, and so was kind of like a go-getter experience or a go-getter spirit. I remember, like, for example, a time in elementary school, I was coming home, I was like bragging about this picture I wanted to draw. I was like really big on artistic stuff in elementary school. I wasn't good, but I really wanted to be an artist, like do some like drawing or something with music. So I was like talking to my mom about bringing home this picture, and I remember the next day when I didn't bring it home, my mom was wondering like, what happened? You're so hyped about this. And I told her what happened. There was a girl in my class that saw me drawing, and I was using a brown color, and she like took the crayon and was like, oh, this color is dirty, just like your skin, Angela. And I was like, oh. I was like 6 or 7, like just unprovoked, like unprovoked racism. And look, of course, at the time I was like, oh, I don't really know what this is, but I don't feel good about it. So when I told my mom that, she was just like, okay, so you're gonna let that stop you. Like like almost like in our household, a lot of things were new to my parents because they had just immigrated to a whole new country permanently. So they had a lot of barriers, a lot of conflicts that they had to overcome. And so there was like kind of just a sense of like, we really can't let anything stop us, especially other people, because if you want to do something like draw a picture and bring it home, then we should do that regardless of anyone trying to stop us. So it kind of grew up with that, like, you know, we need to make whatever is going to happen spirit. And we took that to school, and I took that to like, all the programs that I did. So that's kind of how I grew up in the household that I grew up in.
Yeah. So what about like what got you into wanting to become someone in the medical field, a medical provider? You mentioned
right.
You mentioned the fact that you loved art. So what got you to switch from that to becoming a medical doctor?
Yeah, definitely. So I mean, I liked a lot of things growing up: art, technology. Wanted to be a ballerina. But my parents, they were very practical people. And it's like a part of our culture, and a lot of different like minority or cultures coming from different countries is really like evident that you have to become something because your parents came to this country. You're gonna have to establish yourself in a very concrete way, and usually it looks like becoming like a lawyer or an engineer or a doctor. And my mom was in healthcare. My dad was in business, so I kind of was like, pushed towards the medical field, like almost like, I know my parents want me to do this and I know they wanted to do this. So I want to do this because I'm interested in this so I can kind of live my parents' dreams, which sounds bad, but, and in a way I rebelled against it. Like initially, like you said, I want to do something artistic, but there's a lot of art in medicine and how medicine is practiced. And I, learned that in undergrad. And I learned that as I was going through my grad program and now in med school. So in a lot of ways, I'm still using like that creative part of my brain to do what I'm doing.
Hence why you are a qualitative researcher.
Exactly. You got to use that creative part. You got to think on your feet. You got to like innovate in different sections. Exactly. You get it.
Absolutely. Absolutely. And so your professor invited you to work on this research. So tell us a little bit about the research and what are some medical discrepancies that you all have come across that even, evoked the research getting started in the first place.
Yes. So my professor, Dr. Boreski, is this Canadian Jewish man that moved to Philadelphia about 2019. So 2018, 2019. So he was very unfamiliar with the population of North Philadelphia. I'm not sure if you and your listeners are familiar. It's just a very predominantly Black and brown population. And he's a radiologist by training. So his training is looking at images and recognizing patterns. And when he came across certain images, like chest ray images in particular, that had patterns that he didn't recognize, he went to the books or, searched, scoured the internet medical literature to figure out what those patterns were. And he realized that was hair that was blocking or causing images on the chest ray pictures and other scans that he was reading. So when he realized that there was no like medical literature on this, there's very few times where there's like a gap in medical literature because we've come so far in healthcare and medical literature.
Oh, you just went mute.
Can you hear me?
Yes, I can hear you.
My headphones died, so we'll talk out loud.
Okay. And you actually sound much better without them.
Do I really? Oh, okay.
Yes, you do. You sound much better without them.
It's meant to be.
Yes.
So, what was so when he was looking for what this is called an artifact, something that obscures an image. When he was looking for that type of artifact, hair, he didn't find it in literature. So he realized that this is a gap in literature, and there's a lot of reasons that this could be a gap. Radiology is a predominantly white field. It's traditionally male field. More females are coming along at this point, But so something like Black hairstyles popular in Black communities probably wasn't something top of mind in people who were pioneering the radiology field. So when we found out this was a gap, it's going to disproportionately affect Black and Brown communities because those are the people with hair. And we saw that in literature, because in practicality, anything that obscures it is going to call for additional steps in the medical diagnosis or for anything, because it's like there's a bit of uncertainty. So we have to go to a different part of the algorithm or a different part of the pathway. And so this is just a huge thing that wasn't touched on at all in the literature. People were kind of just stumbling upon it as they were practicing, like years out of like training and into practice and dealing with it however they dealt with it. But we realized that however they dealt with it usually is at the inconvenience of the patient and also at the health system to some extent. Yeah. So he had that in his head and he was collecting these pictures of hair and images, but wasn't really, he was just collecting it really for his own knowledge. And then when we met each other, I also had braids. So I was talking to him about another project that he had advertised to the medical school. He has a virtual reality project in radiology, but he, as we were talking, he was like, realized this project would be really great for me and that I could pioneer and, as he calls it, quarterback the project. So from there, we developed a research project around the phenomena of hair and images. I developed a study. It was a mixed study, like quantitative and qualitative, but I developed that and administered it to physicians. And then we also administered it to radiology technicians who do the scans. So
wow. Okay.
That's a little bit
can you talk a little bit about how hair shows up differently? So someone who has straight hair, a white person, Asian person, someone who has, naturally straight hair, how does their hair show up differently than our hair, differently than Black hairstyles?
Their hair actually doesn't show up in image because their hair is so when we're thinking about how hair shows up, like the hair I have, it's made up of certain microfibers. It's made up of certain materials that show up in an image, because an image is really like an X-ray. It's just a lot of different factors that kind of show up. Sorry, so if you hear X-ray background, it kind of shows up in. It shows up in a certain way based on the fibers that are in the hair. But if you're thinking about like fine hair, like a white person's hair, or let's say fine, but like really like thin hair, it doesn't contain certain materials that show up in imaging. So that problem is missed in that community.
That's amazing, man. That's something that we would have never, ever, ever thought about. And I'm sure something that has caused some issues in the past for people, because doctors just don't know what's going on and then they misdiagnose them and all these other things, So this is beautiful work that you guys are doing.
Thank you.
Yeah, you're welcome. What are some challenges as someone who is studying to become a doctor in your early phases of everything? Like, what have you seen as some challenges that Black people are still coming across in the medical industry? It can be students as yourself, doctors, patients. What are some things that Black people are still having to deal with?
Yeah, I mean, on a student level, I remember coming into school, there was a lot of like orientation the first week, everybody's like connecting, trying to figure out how we got there. And a lot of stories in like the Black students in our school was a lot of like, we were in a program that kind of introduced us to medicine, or maybe we had like a friend who was in medicine, like parents were in medicine, and we were able to like connect there. But a lot of students who were white or white or brown, brown being Indian, had parents in medicine. So it was very much like we kind of knew this specialty and we had experience in this specialty, and our parents have friends in medicine who were able to go and have experiences in their specialties. And not to say that they didn't work hard to get into med school, but it was more of a direct connection to it. And that's still something that shows up like in a lot of different levels in med school to this day. So that's on a student level. That's a different conversation. We can get into another time.
That's called, you know what that's called? That's called cultural capital or social capital. So Black people, because we're not in certain circles, we don't have access to that same societal capital that other people have access to.
Exactly.
Yeah.
No, I was a sociology nerd, so I love those terms. And we might talk later about it, but the organization I started here is based off of that. Like one of the things it's based off is that exact fact, because like a network is so important, and a lot of people who don't have that network coming in and maybe don't have the tools to build that network, that org kind of gives you those tools. So that's also a conversation. But to answer your original question about like different issues in the medical field of disproportionately affecting Black patients, the one that comes to mind, like always on the top of my head, is OBGYN, and the disparities between Black maternal health and if you're looking at Black maternal health and white maternal health, I think a Black patient is like 2 to 3 times more likely to suffer from like post-pregnancy complications than white patients. And that's, in other terms, saying that race is a risk factor when you're thinking or becoming pregnant. And when we think about risk factors in school, we're taught like to pay particular attention to certain factors. Like if you have like, let's say, for example, if you're if being left-hand dominant was a factor for hypertension, then we would pay specific attention to left-hand dominant people and, give certain education and, it's a certain level, it's a certain way of medical care that's different school in clinical practice as well. That's
Oh, Angela, can you hear me?
Yes, I'm back. I'm here.
Okay, you cut off for a moment. You were saying that there was some medical, like you were giving an example. If you were left-hand dominant, then they would be looking for certain things. So please go ahead and continue on.
Okay, so I think from there, I think I left off. If you're left-hand dominant, and it's associated with like some type of like, let's say like hypertension, then you're getting care in a particular way. We're learning about that in a distinct way than if you are right-hand dominant, just because there's a risk factor. But we don't have that same experience when we're thinking about the fact that Black patients are more likely to suffer from these complications than white patients. We don't give that particular care when we're going through med school. And to my knowledge, in clinical practice too. I haven't done my OB rotation yet, but that's from what I'm seeing and what I'm hearing. That's not the care that's standardized to be taught.
Yeah. Did you, there was I believe a Hulu documentary that came out about this topic, about the fact that Black women face disparities when they're giving birth, and the infant mortality rates and things like that are much lower for Black families. So did you get a chance to see that documentary?
I remember when it was coming out, me and my friends wanted to watch it. And I want to watch it still personally. We didn't get a chance to watch it together. There's like a certain level of like, there's a certain level of things that kind of hit too close. It's like, okay, we have to be in a certain mindset to watch it. So we didn't watch it back then, but I definitely want to watch it now because it's
Yeah, I never did get a chance to watch it either, but I heard that it was amazing and brought a lot of things to light that needed to be brought to light.
Good. Okay. Good. Yeah, I'll definitely put it on my radar back again. So
yeah. What would you say if you had the perfect situation with your research? What would you say is the main goal? What would you want to accomplish with this research? The end result. What would you want the end result to be?
Oh yeah, the end result. I mean, I think our end result's very simple. It's education and awareness.
Yeah.
Like this, like we were saying earlier, this isn't in literature at all. Besides, like maybe a case study published, earlier, like years ago, and maybe a couple like dentist case studies, but it's not It's not in the curriculum for trainees, so like radiologists, technicians. It's just something that has come across upon, but this is after already
Mm-hmm.
seeing hundreds of patients.
Mm-hmm.
And so it's just something that's been overlooked. And
Yeah.
we always say like the first step is education, is awareness. Like having this conversation brings more education, it brings more awareness. So putting this in medical literature, having this in a curriculum for med students, but also like med students, but also um, radiologists, people who are in residency for radiology, EM residents, anyone who like comes across scans on this at a certain frequency. Like that's the main goal, is to have this for them to see early on, so that when they are seeing patients or seeing images with hair in an artifact, they're not, referring to more. They're not referring the patient for more imaging, which causes more
Mm-hmm.
radiation, or wasting hospital resources, or just inconvenience the patient because they have to come in for extra imaging if they're outpatient, or have to schedule childcare for their kids or take off of work.
Mm-hmm.
This is just something that should be known.
Yeah. What you're talking about is something that we call decolonizing, right? So you're hoping that your research will decolonize the medical curriculum. There is so many different ways in all industries that educational curriculum needs to be decolonized. And it's amazing to see that in almost all industries, no matter what industry you're in, is there's a need, for this decolonization of the education. One of the things that I found out in the research that I've been doing is that cosmetologists, when they're trained on how to become cosmetologists, their curriculum is curriculum, and all cosmetologists across the United States all follow this same book of curriculum from the Milady curriculum. And in that book, they don't require that the students learn about Black hair.
Oh, wow.
So some, like, a cosmetologist will graduate from school, never have ever touched Black hair before. And they'll go out into the industry, won't having any clue on how to style textured hair. So again,
Right.
curriculum that needs to be decolonized.
It's the colorblind like mentality that people had in like the early 2000s. I think it was just like, we don't see color, there's no differences, but then there's so many gaps that were created based off of that mindset. Like all that technology and all this innovation happening in in the curriculum in cosmetology, or in healthcare, that wasn't a factor. And don't get me wrong, there's ways that race can be a factor that will have a negative impact, but
Yeah.
in certain places like cosmetology or hair school, dermatology is another place where it's like
Yeah.
you need to see different. You need to see dermatology pathologies or issues on different skin colors, because it's going to look different based on your skin color. And there's
Right.
actually like a couple med students globally doing like really great work on that. Like I don't know if you heard of what's his name? I just met him online. Malone. I'm not gonna mess up his last name, but it's like at Malone Meduke. He's this
Is he on
UK.
Instagram?
He's on Instagram. I can like send you his
Okay.
Instagram. He's
Please.
this like UK med. Yeah, he's this UK med student. I think he's Ugandan. But he like he became popular because he started making dermatology images like melanoma, or like Lyme's disease, like the target, like there's like a target that people see for Lyme disease. He started making these things on Black skin, and it really does look completely different. And the text that we see, and we learn in medical school, predominantly has been on white skin, and it's only now that they're trying to incorporate more skin colors there. So
Wow.
his work's been really cool. He's a med student as well.
Wow. Wow. Please, yes. Send me his information via email because I would love to do
I
some
will, and
research
I'll
about
send you
him. Yeah.
yeah, I'll send you another. Sorry, there's another message that just popped
Yeah.
up. Uh, he's Nigerian as well. Chidebere Ibe. He's doing a similar thing where he's making black illustrations for like medical scenarios. So yeah, I'll send you both
Nice.
of them. There's some really cool work
Nice.
happening.
Very cool. Very cool. And so you are an entrepreneur, and so you're a 3-year medical student. So you're in your third year. Is that
Mhm.
right?
Mhm. Yes, that's
Okay. And
right.
so do you plan on continuing on with your entrepreneurial journey? And how do you foresee what you want to do as an entrepreneur? How will that impact what you're doing in the medical field?
Yeah, I think and again, I think I'm always gonna have to have this like that kind of mindset. I think that where I was saying I used to always want to be a creative, like an artist.
Yeah.
It's really I just wanted to be creative, and kind of having like different ventures gives me an avenue to be creative. So I'll
Yeah.
definitely use that.
Oh, hopefully she'll come back.
Okay. Hello?
Okay. Angela, can you hear me?
Yes. Can you hear me?
Yes, I can hear you. Okay.
Oh, it's doing it again.
So you were saying
Okay.
about you're always wanting to be creative. And so being an entrepreneur, you believe that's a way that you can be able to express that creativity.
Yes, definitely. And I go through more training and kind of like gain new perspectives from people I like learning from my colleagues, learning from attendings. It kind of there's certain disparities that come to light, and through that I'll get to collaborate with other people to try to solve anything that we see in our practice. So
Yeah.
that's like really exciting just to think about. So I kind of see that for the future.
Nice. Very nice. How can the audience follow you and keep up with the amazing work that you're doing?
Uh, I'm mainly on Twitter and Instagram, and it's just my name.
Okay.
Instagram is Angela Udongwo, and then Twitter is Udongwo Angela. So
Okay. All right.
anything that
Thank
I'll post
you.
there, I'll post about the research and all that.
Please, please, please do. Thank you so much for the work that you're doing. We need people like you in the industry because there's so much that still needs to be done, to help people. And so I appreciate what you're doing, and I think it's fascinating, and I hope you continue on with it.
Thank you so much, and thanks for having me. Thanks for reaching out. This has been really nice to talk about it. So I appreciate the time.
Yes, absolutely. Have a good night.
Have a good night.
So this is the part of the show where, as an educator and researcher, it's really important that I leave my audience with some information. One of the things that I wanted to do in the process of getting prepared for the interview with Angela is I wanted to pull up some information. And so I have an article here that I want to share with you. It's called Implicit Biases, Racial Disparities in Healthcare. And the reason why this is important is because we all know that racism and biases exist, but it exists in almost every single aspect of our lives. And so the work that Angela is doing, it basically is showing that we're still dealing with some racial disparities. And so this particular article talks a lot about Black people not receiving the same quality of healthcare that their white counterparts receive, different scenarios in which physicians harbor racial biases, and what that looks like. That's the reason why it's so important that when we have access to African American doctors, that we can get African American or a doctor of color, because they're going to understand us a little bit more, because of the fact that there are these disparities. Partly, I truly believe that the disparities come through a curriculum, as Angela and I were talking about. There's no requirement that the curriculum involve learning about diversity in healthcare, and so that's a major issue. But so Please take a look at this article. It was very good. It was talking about also two different illnesses that Black people deal with, Black women, as she mentioned, as Angela mentioned, when it comes to Black women and maternal care, have been for many, many years facing disparities with that. Also, too, mental health. Mental health is something that Black people have faced a lot of disparities in that particular area of their lives. And so there's so much research that needs to be done. We need Black doctors, we need Black healthcare professionals to work with us on these things. And so if you are lucky enough to have a doctor of color, thank God. If you're not, I'm hoping that whomever you are working with, who's serving you in regards to your health care, that they have a better understanding. I remember one time I had a dermatologist that I was working with, and Angela was talking about dermatology. She was talking about a dermatologist, and I had a dermatologist that I was working with, and come to find out, I needed to switch because I was having some issues with some issues with my skin, and there were some things about some of the comments that he was saying that just wasn't relevant to my lifestyle and what he thought my lifestyle was. And so I ended up having to switch to a different doctor. Luckily, I was able to find an African-American dermatologist, and still looking, right? Still looking for that right person. But it's so critically important that we have representation in medical fields, that we really have representation across the board in all of the fields, because unfortunately, we still live in a society where it's not required that they understand us. It's not required that they step into our lives and want to learn more about us. Because we're not the dominant society, we have to learn about them, but they don't have to learn about us. And so it still becomes a challenge. And so I appreciate you all for joining me today. I hope you got something out of this episode, learned something. Who would have known that Black hair showed up differently on x-rays? Who would have thought? Who would have thought that? But this episode of the Black Beauty Activist podcast is brought to you by my book, Black Hair in a White World. I'm on tour right now with the book. Please get your copy if you have not gotten your copy already. I recommend that you get it off of bookshop.org. Bookshop.org is a website that will provide donations towards Black-owned bookstores. So if you have not gotten the book and you want to pick a copy up, please make sure that you get it from bookshop.org. And so I just want to thank you all. I'm super excited about this book. For those of you that have been following me, and I've been on tour, I'm going to be going to Ohio State next week, and then I'll be on my way to California to talk about Black hair discrimination and disparities. And so I appreciate all the love that I've gotten for this book and will get in the future. But thank you all for listening. I appreciate you spending some time with me. If you enjoyed this episode, please leave a comment on YouTube or on Facebook. Share it with those in your circle who you believe will benefit. And then please subscribe to my YouTube channel, The Black Beauty Activist. And as always, please remember, on the other side of fear is your beautiful confidence.